ahead and get started with the afternoon's presentation. It's my pleasure to introduce Dr. Tracy Ting. She's Assistant Professor of Pediatrics in our Division of Rheumatology, and she has many skills, one of which is pain management. The other is ultrasound in rheumatic diseases. So without further ado, I'll have Tracy start with her presentation.
Thanks, Dan. Hi, everyone. I hope you had a good afternoon. So I actually think many of you in the room are truly experts at managing pain and coping. So I'll be very eager to hear your thoughts and ideas. So I'm going to try to talk a little bit about the different types of pain. We know that there's certainly arthritis pain, but there's much more than just arthritis pain. We also want to kind of cover a little bit, why is your child feeling pain, so that we kind of understand a little bit better and why we have to approach things in multiple ways. Then we'll talk about managing some ways of treating your child or helping your child cope through pain. And then we'll talk specifically about the different roles that you guys could have as parents, and then also encouraging your children as well to take a role. So I don't have to tell any of you that pain is a very challenging component of the disease. And part of the challenge of defining pain is, where is it coming from, right? So what is the source of the pain? Could it be that there's active arthritis still? Could it be that the skin is inflamed, there's fevers? Maybe it's chronic complications. The disease itself has led to bony changes. Could it be medications? I'm pretty sure you all know about steroids and the side effects of steroids. Could the steroids be causing some bone pain? And then there are going to be cases where your child looks great. We think that as rheumatologists, the disease is under good control, but yet they still have pain. So what about the non-inflammatory component of pain as well? And then, of course, how do we approach it? So I think specifically knowing that pain comes from different aspects and for different reasons, it's also helpful to understand that there really, I think all of you guys realize this, there's not one magical pill or thing that's going to make it better, but it's really a combination and trying to approach things in multiple ways. So we'll talk briefly about some of the specific standard medical approaches, but then also thinking about psychosocial approaches and sort of the other, I think the most frequent questions that I get are about diet and supplements and things like that. So again, kind of alluding back to the patient more with chronic pain, where everything seems to be quiet, what's going on? Why does this happen? And that's where, again, there's just sort of this puzzling piece of different pieces of pain. And like, for instance, I manage a lot of chronic pain patients, the children that have diagnosis of juvenile fibromyalgia. Those children don't appear to have an obvious source of pain. There's no history of injury. They don't have arthritis, but yet they have a lot of pain. So we know that it can occur even when there's no clear source. And so likewise, children with juvenile arthritis certainly can have pain from arthritis, can have pain from fever and medications, but again, maybe it's also coming from other areas. So I think it's important to understand sort of the different puzzle pieces in terms of addressing and focusing on pain. And so one of the big corner piece here on the left, upper left, this musculoskeletal pain, that's just say arthritis. But we could certainly replace this puzzle piece with migraines or functional abdominal pain. But it's the other components too, these other three components that I think are important to keep in mind. We realize we're asking a lot of you guys to manage the disease, but the disease can contribute to fatigue and poor sleep, and it's so important to keep in mind that and you guys know this, if you're tired, we're just a little bit more irritable, we're more likely to feel things more, so things are going to hurt. And then if you're tired and you have pain in your body and in your joints, you're not going to want to be active, right? So who would want to work out when it's just going to make you hurt more? So that's important. But then if you're not as physically active, you may not sleep as well at night, right? Because you're not kind of moving your body, so your body's not tired. And then I think, again, a very big component is what else is going on more along the emotional aspects of things. Is there a lot of stress at school or at home? And then I think, again, medications can make children more irritable or anxious. And so it's important to keep all of these different pieces of the puzzle together. So it's also critical to kind of understand how does pain work and where do we get those signals from? So it's important to know that the brain does play a role in feeling pain. And that usually pain comes from a signal. So for instance, any of us who touch a very hot pan or the hot stove, we want those signals to be working to tell our brain that we need to move our hands or you're going to burn your finger. But in some certain instances, when there is some degree of chronic pain, that signal doesn't get sent appropriately. And so there's just this open floodgate of pain. And then it occurs, of course, with injury, and then again in your child who might have arthritis. So pain messages come from the nerves in our skin and our tissues and our muscles and joints, and they get sent up to the brain, and that's where the brain starts to try to figure out the different signals. One theory, there's lots of different theories about pain. One of the theories I think is fairly easy to understand and maybe also good for you to go over with your child if you think it would be helpful, is this gait control. So normally, all of us sitting here hopefully are not experiencing pain. We're just comfortable, and what's happening is that there's no trigger for pain, and so this gate here in the middle of your spinal cord is closed. But when you experience arthritis or you have an injury or just you're stressed and you're tired, then that floodgate opens wide open and all you're experiencing is pain. So what's important is really to try to figure out what different ways can we use to try to close that gate so that you get relief of pain. And if you look here, I don't know if you can see very well, but with the brain, it's not just the triggering source. It's not just arthritis. It's also your feelings and your thoughts and how you manage and experience pain. So we know that pain, again, kind of said this a few times, but it's a very complex experience, and it's very sensory. So I was kind of thinking about how to talk about the different sensory components of pain, and I don't know how many of you are from large cities, but if you're walking down a street in New York City, think about all the different stimulus. There's lots of noise, there's lots of people bumping into you, there's different smells, so very sensory. And I don't know if you guys feel this way, but a lot of times I hear from patients and parents that at night, that's when the pain really starts to become worse, and that's because they're suddenly in their own room, it's quiet, it's dark, there's not a lot of stimulus other than sort of the pain that they're experiencing. And then these symptoms and signals are further experienced by sort of your memories, your thoughts, and your feelings. If you took steroids and you suddenly had, unfortunately, a complication of a bony fracture or something, in the future, you're not going to want to take steroids again, right? So you kind of remember these things and you associate certain events with potentially painful things. We also know that lifestyle is very important. We talked about those little 4 corners of the puzzle, but of course, getting good sleep and exercise, and then again, diet and hydration. We know there is a genetic component. So some patients, and we see this in our chronic pain population, that there's often sort of this familial tendency. So grandparents, parents, and then also children may experience more pain than others. So there's a slight component of genetics. And then we also know that in general, different things can trigger different sensitivities. So there's one particular exam that is coming or falling out of favor, but where you do like a tender point examination. And I tend to still like to use it. And what happens is you put a little pressure on your shoulders or different specific tender points. And the kids who are really very sensitive to pain, they kind of jump up off the table. And it's a good way to kind of show a family or a patient that really shouldn't hurt too much, but it's causing you a significant amount. So that sensitivity becomes really enhanced and increased. So we have to think about all these things and trying to help your child with pain. And again, just quickly, there's different, if you look at the literature, there's lots of different evidence and suggestions of these various factors, both genetic, biologic, psychological, and then again, social and lifestyle factors to keep in mind. So we know there's a lot of different components that play into pain, and again, as I said earlier, that means that we have to kind of approach pain in multiple different ways too. So we can't just rely on pain medications because not everyone is going to get the same relief, or there could be side effects that we can't tolerate. And in fact, when you look at the research in pain, it's really the combined approach that seems to work best. So thinking about counseling and how do you manage stress, thinking about physical therapy, occupational therapy, exercise, yoga, and then again, there is a role still for medication, so it's just kind of trying to use that medication maybe to help minimize the pain so that we can be more active and we can have less stress. So again, I mentioned earlier, I'm not going to sort of focus on the medical and the known medications for pain. Your rheumatologist, ideally, or pain team in your area might be able to help you. But let's think about the approaches that, as a family, you guys could work on. So the mind-body approach, or again, thinking about integrative medicine, it's important just to keep in mind that we would recommend that it be used in conjunction with your traditional therapies. But it helps to kind of focus in on the different ways that your brain might appreciate pain, or how those different signals that come to different parts of your brain, so that we can target all aspects of the brain and try to start closing that pain gate. So multiple ways that we can think about integrative medicine, and you guys are aware of these: relaxation, meditation, cognitive behavioral therapy, distraction techniques, guided imagery, yoga, biofeedback. A lot of these methods have all been researched both in children and adults, and with really pretty good benefits. And again, what they're all targeting is really trying to change the effect, that message that gets sent to the brain and the way the brain processes it, trying to correct those or to help your child manage their pain and reduce how they actually feel pain. I think also what's critical to know is that, as with anything, all of these techniques require maybe getting the correct training on how to do them the right way, and then it requires practice. So we won't all just pick up on something really quickly, but with practice and with time, it gets better and it gets easier. So just a brief slide on cognitive behavioral therapy. If you have psychologists who are trained in CBT in your area, I would certainly recommend it. It is a very well-studied and effective approach for pain management, and it's not something that you have to do forever. So it's really a limited course of 6 to 8 sessions where the trained therapist works with both your child and you in specific mind and body techniques. So covering sort of relaxation techniques, the guided imagery, again, pacing, as well as distraction, and then dealing with sort of negative thoughts. We'll talk a little bit about that too. And then parents also play a role in learning how to coach their child. So one simple example. I kind of was gonna just skip over this slide, but then I realized it really makes you stop and kind of appreciate the moment. And so if any of you are interested or feeling overwhelmed or tired and you just wanna go to bed because it's after lunch, just take a deep breath in through your nose. For 2 seconds, hold it. Breathe it out. Think of the word relax. Think about positive words, and have your child or you yourself do it over again. It takes about 30 seconds to do, and it kind of can refresh you and reset things. So if you guys try that even right now as I'm talking, you'll see that it can work. It makes you stop thinking about other things. And then, of course, visual imagery. So for the little ones, you know, if those of you who love Disney or don't love Disney, every child somehow gets exposed to Disney, so it can be that happy place. As a parent, maybe not so happy, but you see your child happy, and so it's a great place. Now, the teenage patients that I have, they all talk about Fortnite. I've not experienced it, maybe John has. But again, maybe it's not the most relaxing thing, but it's something they love and want to do. So finding some sort of specific image that makes you feel good and relaxed. And I think probably for most of you parents, you might appreciate this: going to a deserted island, it's just you, maybe a masseuse, a cook, you know, whatever you need. But this is sort of, can again be that visual image of a place that you'd like to be. Talked again earlier about it kind of being a sensory component or a sensory-driven condition of pain. So again, think about your 5 main senses and think about ways that you can help your child really use all of those senses so that not one single one can kind of sneak in there. I don't know how many of your children have ever tried methotrexate or been on methotrexate by way of liquid, but some of the kids, they certainly say it tastes bad, it looks bad. The whole thing becomes a really awful process, and unfortunately it's one of the side effects of that medication, but again, it's targeting all of these different senses. So if you can, really think about how do you target sight and smell and touch and hearing. And then again, I mentioned a little bit earlier about negative thoughts or worry. It is completely understandable that you as parents would be worried about your children, and that your children are worried about how they look or how they feel, or you know, the medications, another shot that's coming up. So we totally realize. I'm not asking you to get rid of those or expect you to change those thoughts necessarily, but I'm going to ask you to try. And if you see all those, I love those stickers that are in the middle of the table because they're very positive thoughts. So think about these sentences. I can't handle this pain. The pain is terrible. What am I going to do? I can't do anything other children do at school. Very negative thoughts, right? So as parents, can we, and adults and your physicians, can we help to kind of change to more productive problem solving and calming thoughts? So some of the words that are on your table, or just saying, you know, well, the pain won't last forever, and we can maybe try to do some relaxation to help with your pain, and I will be okay, I will be all right. You know, one little exercise maybe if you'd want to try with your children is write some really positive statements or positive words and just post them in random places in your house, so that if they aren't feeling good, they might just pick it up, see it, and be like, oh, okay, I can keep going. So again, there's something to be said about the power of positivity, even when we don't feel like we necessarily deserve to be positive. But I want you guys to try to do that with your kids. Another component that we have tested and know that is helpful requires, again, somebody that's trained in doing biofeedback. But biofeedback is kind of a fun way of having your child or even yourself kind of get connected to technology, and you can watch some different images that are calming, and you can actually watch your heart rate. So they hook you up to a heart rate monitor, and you can kind of, and you're breathing, and they see everything get calmer and relaxed. I saw a few kids with some iPads and telephones already. I know I'm guilty. I am one of the worst pediatrician moms out there, but this is kind of how kids entertain themselves, and maybe we get some free time ourselves. But let's use technology to your benefit. So there are lots of wonderful apps out there in terms of helping with breathing techniques, helping with diaries, trying to keep track of when are you having pain. Sometimes you don't realize there's actually a pattern to when the pain is occurring, and maybe it's because we're sleeping in late or staying up late and then maybe not getting able to sleep in. And so you figure out, gosh, every time this day of the week we are having trouble. So sometimes, again, keeping a diary, it's one more thing to do, I recognize, but it may be something that your child could have control over and kind of start to look for patterns. And again, some meditation apps, so things to do. And you guys can honestly just Google or use your phones and see which ones are out there, but there are a lot. Again, meditation and yoga. I have seen some toddlers do excellent downward dog poses. So it's just to get a nice sort of low impact on the joints, but yet somewhat focused in terms of meditation. So a good way to get a good stretch in that physical therapists and occupational therapists might also encourage you to do. And then it's important to remember your kids can be active. We want them to be active. We want them to enjoy exercise and activity. It shouldn't be a chore necessarily. It should be something that as a family or they themselves can incorporate into the day-to-day routine. And so I put a picture of swimmers because, again, at least it's lower impact on the joints and hopefully a warm pool. But exercise is really good. It helps build muscle strength, so it's good for joint support. And it also will trigger some of the good chemicals in your brain to be released to help you manage and cope with pain. So again, as I stated earlier, when you're in pain, the last thing you want to do probably is move and be super active, but without it, it actually can make your pain a little bit worse. So if you can kind of get through, I tell at least my chronic pain kids, you have to start somewhere. So I'm not asking to do 30 minutes or an hour of activity, even just 5 minutes, but 5 minutes every day is better than not doing it at all. And then as you start to build strength and endurance, it gets a little bit easier and it becomes part of the routine, and then it's really beneficial as well for your joints. And so ask your healthcare provider or each other. I think there's lots of different things to be creative about in terms of activities. And so how do we engage your children to participate? I know some of you with younger kids, it's going to be harder to encourage them or incorporate them, but as they get older, some things that you can discuss with them is start to learn how to track and monitor your pain. So again, that's where those apps could be helpful. And I think it's critical to determine what are your triggers. So again, maybe it's studying for a test and that increases anxiety and they just feel worse. So at least everybody knows what's happening. What things open and close their gate? Is it Fortnite? Is it watching a movie, hanging out with friends? Is it coming to SJIA Day where you get to see other kids like yourself? Practice good coping, so work with them to kind of go through breathing and distraction techniques. And then again, making healthy lifestyle choices. I know it's hard to do, but you can help kind of steer them in the right direction. I think also it's important as they get older to teach them how to communicate with their providers, with their friends, with you, and be their own self-advocate. It's important, of course, to be a good listener. Listen to how they describe their pain. Take it seriously. I know you guys all do that. And try to, again, observe specific patterns. So is it worse at the end of the day? Is it only during the school week and not on weekends? Is it directly related to activities? And what else is going on in your family or in their relationships? I think one critical thing is don't keep asking about pain. I know that I have, again, in my chronic pain patients, a lot of the parents will say, well, they don't ask me anymore, so I just go every morning and make sure, do you have pain? And I try to reassure them that it's a good thing. They're really starting to cope and manage. I know it's not okay. We don't want your children to have pain, but sometimes it's just a fact of the condition. But if they are coping and they're functioning, let's not make it a bigger deal than it is so that you can focus on other things in their life. Try to keep your routine as normal as possible. That helps for everybody. And then again, try not to hold your child back, especially if any of you are newly diagnosed families. It is important for them to have a routine and feel like other kids. So let them participate and be active, and just make sure their support team, the teachers, and other folks understand what's happening. And then again, I highlight pacing. I think more because my chronic pain patients, they tend to be very type A personality, they don't know how to take it slowly, but just encourage them to do that. And again, teach them to be their advocate. Okay, so I mentioned I would put at least one slide on here about diet and supplements, because I think, again, as a rheumatologist, this is one of the biggest questions we get. I have to preface this whole slide by stating that we don't really have great evidence, particularly in children, to be able to say you should definitely eliminate gluten or dairy, or you should certainly try turmeric. There's just evidence that's out there, and I wanted to put some information out here for you guys in terms of some of the pro-inflammatory, so not the great foods versus the anti-inflammatory foods, and some of the elimination diets and supplements that have been looked at least for certain in the adult population. But a lot of these studies are tricky to really take. I think we have to take it with a grain of salt, because there's so many other variables when you're talking about diet. We can't eliminate everything, so it's hard to know. But I think in general it would be safe to try, but certainly talk to your rheumatologist first before you take on one of these. But I think if you see the pattern is generally eating healthy is important. So some final recommendations. Again, don't be shy about discussing pain with your healthcare team. The hospital, this institution, and I imagine most of yours as well, it's required that we ask, how much pain are you in, as soon as you step in the door. And again, we know clinic visits are busy. We're talking about medications. What do your labs look like? Do you have fever? And we kind of sometimes maybe forget about pain. So don't hesitate to ask, because there might be a resource right at your hand that you haven't thought of. And we also are busy, and we don't necessarily think about pain and how we can help you in that manner. So make sure to ask if you feel like it's really impacting your child. Again, traditional medications, again, apologize that just we don't have time to go over all of them, but there's lots, right? So think about anti-inflammatories, not even for disease control, but just muscle strain. Think about sleep aids. Are there certain things that are struggling? Your child just can't fall asleep at night. Think about those that you could talk with your rheumatologist about. And then over the counter, I put numbing creams like Biofreeze or Bengay. Those kinds of things can also be supportive in a very sort of short-term process. Please utilize physical and occupational therapy. We are very fortunate here that our therapists are part of our team, so they're in clinic with us all the time. But if it's not something that you routinely get recommended to do in your area, think about it. Ask your rheumatologist, get a referral. As a parent, I understand that my kids don't want to do anything that I ask them to do, but they might do it for somebody else. So that's where, again, having outside resources or coaches to help them can be helpful for you guys as well. And then aquatic therapy, again, using that pool, to kind of have that low impact and that warm water therapy. And then I wish I knew more about music and art therapy. It wasn't until I had a roommate who happened to be a music therapist that I realized the benefits. But you know, if you guys are driving in your car and suddenly a song from the 80s comes up, I hope that's okay, but the 80s, and you're thinking, gosh, this is bringing me back to my college days or my high school days. It's important. Music is very powerful. So getting your kids to dance or to do artwork can be really helpful when they're in the middle of a pain spell. And then again, utilize your psychological resources for CBT and counseling. And I know I really didn't talk about needles and other things that you guys all have to go through with lab draws and potentially medications, but there are things out there. So there's a new J-tip form of lidocaine that kind of pressures lidocaine into the skin. I've heard really positive things from some of our patients about that. Ice, those distracting devices like buzzies. Again, hopefully you guys can share with each other about what really works for you, but it's of course important to know that what works for one family may not always work for somebody else, but it is certainly worth trying. And then think about the school, and I think there was a really nice session yesterday, but if you can, send in heat packs with the kids, ask them to be teachers' helpers so they don't feel like they're being called out so they can go walk because they're stiff. And then teach them to do some stretches even while they're just sitting in class. And then again, if you are considering more the integrative medicine approach, weigh your benefits and risks with your rheumatologists and clinicians. Weigh the costs. Unfortunately, a lot of these things are not paid or covered by your insurance, but maybe by HSAs or FSAs, so think about that. And then really try to find somebody that's qualified who really does know what they're doing so that you don't harm yourselves or your child. And And I think this slide basically just sums it up. Please talk to your rheumatologist. We want to know. We want to help you and your child. Think about the medical management, medications, PT, OT. And then again, these behavioral and lifestyle changes are really critical, and they're generally safe without long-term side effects. They do, in general, just being healthy and having a good active lifestyle, it helps with both physical and psychological well-being. It will help get your child more engaged and back into their daily school activities, and then hopefully just makes pain a little bit less scary and gives your child a bit of a sense of control over their condition, or at least their pain condition. And some of these slides, I have a great collaboration with our pain psychologist here at Cincinnati Children's, and she had recommended a couple of these books that are out there. They are a little bit more geared towards chronic pain, but again, a lot of these measures, as you guys are hearing things, some of our patients will have chronic pain without active inflammation, so it can certainly apply to your children as well. So I'll leave this slide up, but if there's time, take some questions.
How do you know when to push your child?
So
There's that line where you're like, are they really feeling that bad? Or come on, you can do 5 more minutes. And
Right.
That's the sticky place.
It is. I think parents, you guys know your children better than anyone. They obviously know you better than anyone too. So you're right. Sometimes there are going to be moments where maybe we overpush, but you'll see it. They'll tell you. You use your usual cues. You know, if they're fearful or tearful or angry, maybe it's just not even worth trying that battle. If they're laughing when they're not looking at you, then of course, you know, let them be. I think a little 5 more minutes of playtime is okay, but maybe not try to go an hour, right? So kind of also thinking about that. I don't really know if they're pulling my leg or if they really don't want to participate, but maybe it's good to just cut it in half. And so they still get an opportunity to do things, but don't feel like you're not listening to them either. But I'm sorry, I don't think you will hurt your child either. Now, not if you go hiking for an additional 5 miles, but I think it might empower them to realize, oh, I could push through that pain a little bit more than I thought I could. And hopefully from a joint perspective, it's not causing any damage to their arthritis either, okay? That's a very general statement, but.
I just have a question about parenting young children with pain. So we have a 3-year-old who was diagnosed, and we didn't even know she was in pain at all until we finally got her treated and realized, oh, she's a lot more pleasant now. But how do you have any tips on knowing when they're that young? You know, when they're in pain versus when she's being 3, right. And when we need to discipline her or when she's acting out because she's hurting. We struggle a lot with that.
Yeah, I don't know if there's one right answer to that question because every situation is a little bit different. And as Dr. Toe was saying earlier, normal things still happen to your normal 3-year-old who really knows, I want a little bit of candy, I'm just gonna, you know, or I don't want to walk, I'd rather just sit in this chair and be pushed around. So I agree. I think it is very, very challenging, and it may be really helpful to talk to each other also about what kind of cues do you use. You know, I think thinking about the situation at hand, you know, have they been recently in a flare-up, and maybe really they are experiencing pain? Have we gone longer than usual? You know, thinking about what the situation is at hand, and as if you guys aren't juggling enough, but just kind of really stepping back and looking at the big picture. Could your child really be in pain because maybe our medicine was delayed a few hours, or, you know, there are going to be different situations. I don't know that I have the right answer. If you met my toddlers, you would know I don't have the right answer. But I don't think you will do them harm, I guess, by trying to push them a little bit more, or at least trying to coax them into kind of working through their pain, even at 3, you know, or finding other distracting techniques. Maybe you can't keep walking through the store. Maybe we'll just sit there and rest and do something that's kind of fun, and for 5 or 10 minutes, and then get them back up and go again, right? So at least you're acknowledging that there's pain, but you're not letting it stop you from being active.
I have a question. We've all been in the hospital, and reach that level where they've just had it and had enough. When they get so extreme where you can't reason them down, you can't distract them down, you can't. I mean, there was one point she was on steroids, infusing, and we had to do a sedation to get an IV in, and she woke up really pissed off and was trying to yank IVs out. And she's 6, very strong, and I'm trying to contain her. And is there any tricks, anything you guys know, like through the hospital, stuff to just keep them safe, keep them from yanking IVs out, and maybe kind of de-escalate the situation?
Sometimes I don't know how. Again, I think your peers here have such valuable information because they've gone through the exact same experience as you. One thought that came to my mind was sometimes you, as a parent, actually has to step out of the room, have the nursing team come in, have child life come in, let them know, because again, it's a scary environment to be in the hospital, so I completely understand that, and it seems even scary to not be there for your child. But sometimes if they see you, it just makes them more emotional a lot of times, and you are emotional and upset and angry. So again, even just for a few minutes, or stepping out the corridor and having somebody else come in and help you diffuse the situation. And maybe there's truly pain, so don't hesitate to talk to the nurse, to call the docs or whoever to come reevaluate your child. Okay, thank you all.
Thank you so much.